I'm Filip Djordjevic from the Burnet Institute, and today I'll be talking about some of the preliminary results from the Burnet Institute's EC cohort study, in particular reported rates of injecting drug use related stigma and their relationship with health service utilisation. What we know about stigma in the healthcare setting is that it can become a barrier to seeking treatment. What this means in the context of hepatitis C is that it can lead to less intention to seek treatment for people at risk of or living with the virus. So if we are to achieve elimination of hepatitis C in Australia by 2030, it's vital that we address this barrier so that people who inject drugs can feel more comfortable about getting tested, treated, and receiving care for hepatitis C. The EC cohort study is a longitudinal cohort study aimed at identifying the barriers and enablers to hepatitis C testing and treatment. So far, there has been recruitment from 4 sites, roughly 70 participants from each site, for a total of 280 in the sample so far. And recruitment has targeted people that are either not engaged in testing or diagnosed with hepatitis C and not yet gone on to treatment. This particular analysis is using an ordinal logistic regression model to explore the association between the number of different health services accessed in the past 12 months and the level of injecting drug use related stigma reported in the past 12 months, on a scale of never, rarely, sometimes, often, and always. We also adjusted for recent injecting drug use, gender, and age, as we would expect these characteristics to have some impact on the level of stigma experienced. Firstly, this is how participants answered when asked how often they experienced injecting drug use related stigma in the past 12 months. Never was the most common response, closely followed by sometimes, with always being the least common. Moving on to the results of the model, health services accessed by participants were collapsed to create 5 categories for the ordinal logistic regression model. While the sample size is too small to provide statistically significant results across these 5 groups, we can still see a clear pattern that shows the odds of experiencing stigma increasing with the number of different health services accessed, from 1.09 through to 4.23 in the adjusted odds ratios. The 2 dominant interpretations of these preliminary findings are that healthcare services are a source of stigma and accessing more of them will lead to people experiencing more stigma. And secondly, people are already experiencing stigma due to existing physical or mental health conditions and are accessing more services. Given that the literature on stigma, injecting drug use, and hepatitis C shows that stigma is more likely to be associated with accessing fewer health services, this is an interesting preliminary finding. Moving forward, we will continue to monitor trends in stigma and health service utilisation while we recruit more participants into the sample, obtain follow-up data, as well as incorporate linked Medicare data for more accurate points of contact.